I'm Alan Scott. I'm the head of clinical services here at Hampden Sports Clinic. So I'm a physiotherapist, and my responsibility is for all the physio team, the podiatrists, the sports masseuses, in order to provide a great service to all our clients. Yeah, so Focus Shockwave is a new method of treatment that we have in the clinic that we're very excited about, and we've found some excellent results in the clients that we've worked with over the last few months. It helps in reducing recovery times and improve pain control in difficult to treat conditions with some patients. So Shockwave is essentially a form of energy that develops peak pressures for up to 1,000 times that of normal therapeutic ultrasound. Therefore, it gives us far more effective treatment on symptomatic tissue. Our Focus Shockwave system can concentrate its energy in the target site and with penetration depths around 5 mil up to 40 mil, so it allows us to kind of work at different depths for different tissues and allows us effectively to treat against deeper problematic tissues there. Some of the proposed mechanisms for Focus Shockwave are pain relief through hyperstimulation of analgesia and the stimulation of new blood vessels to improve circulation and healing potential to the injured area.
So what types of injury can it be used to treat?
Well, the best effects clinically we have seen in from the studies are basically for tendon pathologies, so that can be things like rotator cuff issues in the shoulder, tennis or golfer's elbow, hamstring tendon, patella tendinopathy, Achilles issues or kind of plantar fasciitis. So the most common tendon-based problems we treat, but it's effective and it's not just limited to these pathologies as well. In conjunction with an MSK ultrasound scan, we can target the area of injury, and we can be very specific with the areas that we treat, so we can be sure we're getting to the right cause of the problem from there then. It's also effective in treatment of tendon calcification issues, which can be identified after some imaging scans, be it ultrasound or x-ray, and we can also use it to treat stress fractures, stress reactions in runners, or in some cases delayed bone healing in some conditions.
Great. And is it painful at all?
So you will experience some pain with this therapy, and it is normal to feel that, and it's important that you feed it back to your therapist when we're doing this. This allows the therapist to know that we're targeting the right area. So essentially, yes, we do want a little bit of symptoms when we're treating this as well then. So the feedback from the patient allowed us to be quite specific where we're putting the probe, and also allowed us to target the right sort of area. So essentially, pain should subside straight after treatment, and effectively a lot of patients feel they get good pain reduction over the first 24 to 48 hours, even after one treatment session, and we hope that builds on as we do more treatments over the course of your therapy sessions.
Right, and typically how many sessions does it take to see improvement?
So we would initially advise at booking kind of 3 sessions over a sort of 2 to 3 week period decided on by your therapist there. So these sessions typically last about 15 minutes, and the flexibility we have within our diary system means we should be able to suit you at a time that suits yourself from here then. In some more stubborn and chronic conditions, we may find that we're actually looking at doing another session of 3 afterwards, but that is only in some cases. And in any treatments that we do, the therapist will talk through the rationale with you, so it's a decision between both parties as to what would best suit you and how many sessions would best suit you as well.
How would one book in for this treatment?
So your treating physio or podiatrist will discuss all the clinical reasoning behind this, so therefore you have informed decision making between both parties here then, and why they would recommend Focus Shockwave as opposed to any other treatment that you may have. They may also trial an initial session, so in your initial physio consultation you may well have an initial Shockwave session there at no additional cost. That's almost like a taster session, just so you feel what it's like, and hopefully you get that initial pain relief before you move on to your kind of 3 sessions from there. So Focus Shockwave has been proven to work more effectively alongside kind of bespoke rehabilitation, so it shouldn't be used primarily as the only line of treatment. What we're looking at as well is that it goes along with rehabilitation or other exercise as well, so we want to try and load the tissue that we're treating from there then. So it's not meant to replace any forms of treatment, it's certainly seen as an adjunct to kind of complement that. We would look at patients booking in a few different manners, so you can either phone into the clinic and book specifically in to see a physio for an initial treatment session, and then we will book in Shockwave as a result of that. You can do it online, just through our normal kind of online portal at hampdensportsclinic.com, or you can do it initially when you're with the therapist in at that session. So there's a few different methods you can book in for Shockwave.